First of all, I want to start with the 340B messaging that we heard this morning. I strongly agree with the messaging, not the actions, but the messaging. My rural communities are served by the FQHCs. Without them, the delivery of medical services, mental health services, dental services to residents, to the migrant workers will be severely impacted. So I hope that will be something that we will be taking a look at. Real quick, Dr. McDonald, you had mentioned in the budget the various investments to emergency medical services statewide, which I truly appreciate, representing a rural district. It's incredible the need that exists. And you may be aware, if not, I want to make you aware that in 2021, the legislature realized the significance of the problems that we are experiencing, and the governor signed into a law legislation creating the Rural Ambulance Task Force. Again, that was signed into law at the end of 2021. In 2022, it is tremendously disturbing to me that that task force was never convened. I understand that they have met once in 2023. Their report is due back to the legislature at the end of this year, December of 2023. I'm hoping that you will be looking for the information, the recommendations, and that will help guide some of this funding.
Yeah, absolutely. So I'll look for the report. I just took over as commissioner January 1st, so I'm getting a list of all the mandated reports, finding out where they are and getting them back, and I want them back to you on time. That's the Navy officer in me that's used to doing that, quite frankly. So we'll see if we can get that done for you. Thank you.
I appreciate it. Superintendent Harris, it's great to see you again. I wanted to switch gears and talk about the pay and resolve proposal that's in the budget. It's my understanding that New York's existing external review law, it's been a model that's been used by many states across the country, and in fact, a model that's been used by the federal government. And would you agree that the existing law resolves disputes between hospitals and plans by having an independent third party determine in a short time frame whether the claim was medically necessary?
Yes, I think that's an accurate statement.
Then I'm wondering why the department feels that this pay and resolve proposal is necessary in the context of the budget.
Well, the pay and resolve proposal is limited to instances of emergency admission where medical necessity is not in question, and it is meant or intended to help increase efficiency for those payments in the case of emergency admissions.
So are you saying that presently there are slowdowns with the payments? Payments aren't being made in a timely manner under those circumstances?
I think we have requirements for the timely payment for medical necessity currently in law, as you noted. This proposal is narrow and limited to emergency admissions, and I think a good way to test if this will increase efficiencies even more.
Okay, another question on the proposal. Many of our upstate hospitals have cooperative plans with the health plans that either offer monetary advances to hospitals to aid with cash flow and or accelerated payments, agreements that expedite payments. It seems to me, based on everything I've heard, that these agreements are working quite well. Wouldn't this bill replace those agreements?
I think in the narrow circumstance of the emergency admission, but I can confirm and come back to you.
Thank you. I guess it seems to me that the current process is working effectively. I received correspondence indicating that DFS data from the first quarter of 2022 shows that health plans received 104 million claims, and denials related to medical necessity accounted for less than 1% of all claims. So again, I'm wondering why we're trying to fix something that it doesn't seem is broken. And I only have a couple seconds. I'll just wrap up by saying this. When I read the proposals that are in the budget, ultimately I'm thinking about our constituents, our consumers. And I see proposals like the 340B that are going to take away services to the most vulnerable populations. And I see proposals like this one and some others that ultimately will drive up costs to consumers. So I'm looking for changes in the 30-day budget amendments in the final budget. Thank you.